Hi everyone. Today we're going to be talking about stress, urinary incontinence. This is leakage with a cough, sneeze, or laugh. We're going to be really focusing on conservative therapies, so not surgical, all right? So conservative therapies. First of all, you can do nothing. Why? Because it's not going to kill you. Stress incontinence is leakage of urine with a cough, sneeze, laugh, and it does not shorten your life any. So if you wanted to do nothing, you can. Number 2, you can do pelvic floor physical therapy. The idea here is that stress urinary incontinence is due to weakness of your pelvic muscles. It could occur with age, it could occur with pregnancies or vaginal deliveries. You know, even if you had a C-section, you could still have stress urinary incontinence. So any kind of prior surgery, like even a prior hysterectomy, you could have started leaking more with cough, sneeze, laugh after your hysterectomy. So surgeries can cause this too. And the idea here is that pelvic floor physical therapy is going to help strengthen your muscles. It's not just Kegels, right? I don't want to oversimplify pelvic floor physical therapy because they really work on multiple levels and with multiple different muscle groups to help strengthen your pelvic muscles, because there are so many different muscles involved. And also they'll use different methods to try to train you to connect your mind with those muscles, because it is not an easy thing to do. There are a lot of people who think that they're doing a Kegel, and it turns out that they're not. They're actually just squeezing their butt muscles, which are the gluteal muscles. They're not at all the muscles that surround the urethra or the vagina. So really, it's worth going to a physical therapist to learn how to properly do pelvic floor training and strengthening. Number 3, you can do an incontinence pessary. Now, an incontinence pessary is a special vaginal ring that goes into the vagina and causes a kink. So I'm going to draw one out for you. It's a ring like this. Okay? It has this fat part here, this little knob. And this knob is what kinks the urethra. So, for instance, let's take a picture of the bladder and the urethra. Okay? So this is your bladder, this is your urethra, urine comes out from here. Now, if it's too mobile, like too loose, basically, because you don't have the strength to keep the urethra in place because of the weakness, you'll leak a lot more with activity. Basically, once you introduce this pessary right here, this fat knobby part will go right under the urethra, and the rest of the pessary will sit in the vagina. Okay, it's placed in the vagina, and it'll cause the urethra to bend a little bit. So instead of being straight, it'll bend just a little bit like this, and that bend is enough to help decrease the leakage of urine. All right. This is something that's easy to manage. Either you can learn how to manage the ring yourself, or you can go to the doctor and every few months have it checked, removed, cleaned, have the vagina checked, and then replaced. Okay. So an incontinence pessary is another great method to help with incontinence. You can use it all the time, like every day, or some patients use it on an as-needed basis, like maybe only when they go to the gym, or only when they go playing with their kids. And it can be used long-term, or it can be used as a bridge to when you're ready for surgery, or maybe, long-term in that you don't need to even use it every day, just as needed. So it's good for anybody, any age. You know, something that I do a lot of in my practice, fitting pessaries. because patients like having the non-surgical option. The next video, we're going to be talking about surgical approaches, so just stay tuned. Thanks.